Hi, I'm Dr. Adrian Avila. I'm a licensed marital and family therapist in San Diego and clinical director at Harmonic Development. Today, I introduce to you our esteemed guest, Dr. Knudson-Martin. She's a practicing marital and family therapist and clinical supervisor at Portland, Oregon. Dr. Knudson-Martin is a retired professor at several universities that include Montana State University, Valdosta State University, Loma Linda University, and Lewis and Clark College. Her lifelong scholarship focuses on how larger contexts influence health and well-being, and how therapists can address the inequalities that result. Dr. Knudson-Martin is widely recognized for her work regarding gender, culture, marital equality, and relational health. She's also one of the founders of Socio-Emotional Relational Therapy. Dr. Knudson-Martin has published over 100 articles, several book chapters, and authored or co-authored books that include Couples, Genders, and Power, Creating Change in Intimate Relationships, Socioculturally Attuned Family Therapy Towards Equitable Theory and Practice, and her new book to be released in December, A Step-by-Step Guide to Socio-Emotional Relational Therapy, A Socially Responsible Approach to Clinical Practice. In addition of these, Dr. Carmen has been an esteemed consultant and a very important mentor of mine. Dr. Carmen, thank you for being here with us.
Thank you for inviting me. It's really a pleasure, and I enjoyed meeting your colleagues this morning and having such an interesting conversation.
Okay, thank you very much. Dr. Carmen, today I would like to discuss with you your working model, your SERT model, Socio-Emotional Relational Therapy, in working with veterans. Veterans are making a transition from military culture to civilian life culture, and that transition is not a simple one. I would like to hear some of your ideas of how your therapy model can help us help veterans.
Yes, thank you. Well, first of all, SERT, Socio-Emotional Relationship Therapy, was developed out of research where we actually studied our clinical practice, trying to understand how the factors from the larger society were playing out in what we were doing in the therapy room. And you, Adrian, were a part of that original research. So we've continued to evolve it and develop it since then, but you are also one of the founders of this model. Whether working with people transitioning from military culture to civilian culture, or whatever other issue people are bringing to therapy, SERT is unique from other models in that it always starts with sociocultural attunement. And what I mean by that is that the therapist tries to really get to imagine, to take in what it is like to be this person in the particular contexts they live in. So in the military context, I know that the military is organized very hierarchically. I also know from decades and decades of research from all kinds of sources that what relationships need is mutuality and reciprocal responsiveness to each other. So I begin by knowing that there's a difference between what people need in their close relationships and what is necessary if you're working and living in a military culture. I don't know what that means to particular people. So working from the SERT model, therapists begin by trying to understand that better, by getting to know more about that. And I'm sure we'll be talking more about that in a little bit. I also know that that there is this divide between the experience that people have in the military, which is very intense, where you need to follow the orders and direction that you're given, and what people in civilian culture experience, and that not for everybody, but oftentimes that experience is not only, military experience is not only not understood, it's also often minimized or disparaged, and certainly can create not only misunderstandings, but I think what's even more important from what we know about what people need is it creates distance between people. So the other point that's so important that I would bring right from the outset as practicing SERT is an awareness and wanting to understand what it means for the particular person or persons that I'm talking with, working with. We all need to be able to be open to taking in the experience of others and feeling loved and valued and supported by them, and that it needs to be an open flow that goes back and forth, and that is directly related to physical health, emotional health, relational health, well-being in general. So I know those things, and what I want to know is how is that working if you're my client in your life, and how has these different contexts, the military context, whatever other race, class, gender, community, family, experiences of trauma, how have all of those come in and sort of worked together to either support building human connection or to get in the way of that?
What are the core principles of socio-emotional relational therapy?
Well, there's really just a few. The first, as you might tell from the name, has to do with the societal context. So that's the messages that people receive about who they are, what matters, whether they matter, whose experience is important, and why. And those are shaped usually by the people with most power in society, but it affects everybody. So that's the socio part. And then there's the emotional part. And that is that as human beings, we are emotional. We're meant to be emotional. So our emotions are the connection between us as individuals and the larger society, and it's how we communicate quickly because we have to adapt to our environment. When things are going well, people are able to be open to each other. They can take in their own experience, somebody else's experience instantaneously at an emotional level before oftentimes it's even able to be a fully formed conscious thought or anything. But if people experience trauma, or if they've been socialized, as you are in the military, to kind of disconnect from that emotion, then people actually aren't even able to make good rational decisions. So that's the emotional piece. So I'm always interested in the connection between those two. When somebody is experiencing a feeling, an emotion, I know that that's related in some way to the relationships around them and the larger society around them. Which means that I'm also then interested in power. And that's a confusing concept for a lot of people, but what we mean in SERT by power is awareness that just by nature of being connected to one another in a shared world and in relationships, we affect each other. So power is about, it's not a personal thing, like it's not that I'm powerful, but it's a flow of power from one person or group to another. And that power determines whose interests are important, who gets attended to, who feels valued and attuned. And of course, in a well-functioning relationship that needs to go back and forth. And then the fourth thing is what I've kind of already mentioned, which has to do with relational needs, that everyone has them. Some people, because of their experiences in life, or what they've been taught, they feel like there's something wrong if they feel those needs or recognize those needs. And if you're in the military, I'd be curious to know kind of how that works. But when you're needing to be responding to orders, what your relational need might not be important at that moment. And so what happens and how do you do with that? So those are the 4 principles. Then what's really fascinating and for our work as therapists, and can be painful for people who are struggling with whatever issues brought them to therapy, is that there are so many different pieces. It gets very connected to vulnerability. It gets connected to our identities and how we know ourselves. So those are the main principles.
So you mentioned trauma, working with veterans. That's one of the primary things that we're working with. Mm-hmm. How does SERT, how does socio-emotional relational therapy deal with those kind of thoughts or ideas?
Yeah, when most people come to therapy, they don't usually come because they're happy about everything. And so they're struggling with something, or they're wanting to develop an aspect of themselves that they think could work better, their relationships. And it's easy so we either blame ourselves, or we blame our partners, and oftentimes we blame our parents, our mothers especially. And what SERT does is, yes, we learn to be accountable and responsible to each other, but we learn to see how we are also often falling into patterns and ideas that are in the society that we live in, and often they're competing, like being in the military is one set of values, and maybe being in therapy can feel like another set of values, and different cultures might interpret them all a little bit differently and such. And so with trauma, what has happened, whatever the cause, whether it's PTSD because of combat injury, whether it's witnessing violence to someone else, being the experiencing violence, or even the day-to-day, like being diminished by others that you're working with every day, or in the society through racism or other messages that say that you should be different than you are, we tend to blame ourselves. And trauma, what happens on a physiological and relational level with trauma is that the very same things that we need to be healthy, those relationally responsive connections with others, get shut down. And it's harder to trust, it's harder to even trust your own experience and what you're feeling. And what people need to get through that is others that can understand it and just sort of be with them in it. And people who have the more healthy relationships we have, be it our intimate partners, be it family or friends or a church community or whatever other groups we might be part of, they do better. And trauma skews a lot of things. And so the way that different people respond to trauma. Our group was talking earlier this morning about a case that you and I both worked on when we were starting to develop SERT, with a couple where the man had experienced PTSD from war experience, and his wife from interpartner violence, a different partner, not him. And both of them needed closeness and connection, but his way of dealing with it was by what he'd been taught in the military, what he'd been taught by the, a culture that said as a man he wasn't supposed to feel vulnerable or needy, and so he would distance from her, and then that would make her angry and not respond, not able to respond to him and what he needed. And when they came in at first, they were neither one was doing very well individually. She was psychically almost a wreck. He was almost a recluse. But by working with a compassionate, socio-emotionally attuned SERT therapist, it took them a while, but they were really able to develop some new patterns and deal with that trauma. And so how trauma plays out in people's lives has to take into account those. It's not like one size fits all. There's this stuff that happens in the body, but that really interacts with all those other factors in our world and what we've learned about what's called on us, the ideas about our identity and how what we think and do and feel.
You talked about identity, and what we see is that many folks enter the military at a very young age, when they're typically developing their own identity. So they enter the military culture and their identity takes a course. When they come out of the military, a different thing happens. They're part of a different world, and they have difficulty navigating how to become members of society, of having families, of having children.
Yeah.
How does SERT help to deal with that?
Well, SERT really works by thinking about or focusing on felt identity. So identity isn't just like, okay, I'm this white male, or I'm this husband, or whatever identities are important. It gets internalized inside us, so that it connects to the emotion that we feel. And when our identities are not validated, then we usually try to defend them. And so if someone spent most of their early adult years in a system that has very clear expectations about how you're supposed to relate, and then someone else, maybe your intimate partner, is not respecting that, or doesn't seem to be respecting that, or wants something different from you, then you not only feel incompetent or invalidated, but you don't know who you are, you don't know what to do. So one thing that SERT does is we have a set of what we call orienting principles for a relational identity, because we have, all of us have multiple identities. Like you can be in the military and have a relational identity, and you have to traverse going back and forth. And even if you're a veteran, you can't, you've had this experience. It's a part of who you are, but it's not the only identity. But I think a lot of times the way identity gets kind of talked about in our society It's like there is just this one way of being. And if you're, if I'm feeling attacked because of my identity, then I don't know what to do. And so the circle of care gives another framework. And there's 4 components of those, and we can talk more about those, but very briefly, they are things that may not fit with a military identity, like vulnerability. Each person being open to taking in the experience of someone else, even if it makes us feel uncomfortable. So it isn't only about expressing your own fears or doubts, but it is willingness to do that, to share what you're worried about or what you need relationally, and to own that you have those needs. And it's like a spirit of curiosity rather than like you don't have to know everything. So that's vulnerability. That's number 1. And it's a part of a relational identity, which we call the circle of care. Second is what we call attunement, mutual attunement, when it's going back and forth. That means I not only expect you to understand me, but I'm focused on you. I'm noticing what you need, what you want. Now, in a military identity, those things are probably important in a lot of ways, but ultimately you're responding to somebody's direction, or you're giving the direction if you're at the top of the command. And so attunement is a much more egalitarian sort of back and forth about I get you, I want to understand you, I know we're 2 different people or 2 different groups, so we're not always on the same page. And that's then related to influence. Like if we are in relationship, we are influencing each other, necessarily. It's impossible not to. But if you've been taught that you shouldn't be influenced by someone, that you should be on top, and if you've been in a hierarchical context, you may, without realizing it, sort of operate that someone is always on top. If it's not, your commander, then it's someone else. Or if you're taking influence from your wife, maybe it feels like she's on top, and that doesn't feel good. So what is a relational identity? How might that be tied to masculinity, to whatever other identities someone might have? And then shared relational responsibility. What does it mean for me to think of myself as responsible for bringing who I am to that relationship, for noticing and caring about and feeling responsible toward the well-being of my partner or the others around me, and responsibility for the well-being of the group as all. And I think some aspects of being in the military very much promote that. And each person, it might work out a little bit differently. But I don't know that that's the answer you were expecting. But when I think about identity, I think I always come back to that identity is actually a relational thing. Like we only have our identities in relation to somebody else. I can't be a wife without a partner. I can't be a mother without a child. I can't be an employer without an employee. What it means for me to be a therapist is defined by professional standards, as well as what my clients think and my training. And it feels very individual, but from my perspective, from a SERT perspective, it's actually very relational. So your identities change whenever the relationships you're in change. And that's okay. I mean, like, we aren't all exactly the same person in each context. But some parts of our identity often don't get developed. So in SERT, we're really developing parts of our identity that might have been overlooked before, and that's not your fault. It's not the person's fault.
Relational identity, when veterans are used to having a hierarchical type of relationship, then they come out to their families, their spouses, or other relationships, and they want to have equal relationships, but it doesn't seem like they know how to.
Exactly. That's been my experience. Nearly everyone wants relationship, they want connection. A SERT therapist has developed the skills to help you name and identify those, because in our larger society, we don't very much. We talk about achievement, we talk about individual choice, we talk about a lot of things, but we don't necessarily help people recognize their relational ideals, and I absolutely agree. It's not that people, I always assume, and I think other SERT therapists assume the same thing, you know, that people want connection, they want relationship, and sometimes the symptoms or problems that bring people into therapy are a sign or a outgrowth of not knowing how, and that those things have then created oftentimes an imbalance in whose needs are getting addressed. And it's a problem between people, not a problem that belongs to just one person or the other.
Yeah, I see that in some veterans, they come out and as if they had enough of being under a hierarchy, and it gets into matters of power, and they don't like to be told what to do or how to be, and they struggle with their wives or their husbands telling them what to do.
Yeah, and you know that happens. It's not just military people who struggle with that, but resist being influenced by your wife. You don't, or you want to be the one to make the decisions and be in charge. Even people who identify, you know, like for religious or cultural reasons as head of the family, they want to play that role, but they want to do it in a more relational way, or some of the trauma or abuse or socialization they've had are making them do it in a more hurtful way. So it ends up hurting others, and then it keeps the client from having the connections they want, if in the example that you gave.
Power issues get in the way of fulfilling what one really wants.
Right. And you want a therapist who actually notices power issues, because yes, there's some relationships where dominance is really it's visible, and we all notice that. But a lot of the kind of things that we're calling power here, they're much more subtle, and they play out in ways like whose interests are shaping what we talk about. And if therapists don't notice it, they tend to, it's easy to reinforce those power differences, but you can't understand that unless you back up and look at the bigger picture and see, well, then what's affecting that relationship? What are the societal patterns that are getting in the way of people having the kind of relationships they want? Because I absolutely agree. At least people who are willing to come to therapy, it's very rare that someone says, no, I think I should be the one to make the decisions. She should just do what I say.